Hi, and welcome to the Spawdcast. My name's Carrie Hyde, and I am your host and your pet's life coach. Today, we are going to be talking about herbs. And if you watched our last episode last week, then you know we talked about Wilma, who was diagnosed with cerebral palsy, and how her fireman turned herbalist saved her life. But today, we're going to bring on an expert, a veterinarian expert, and we're going to be talking about herbs specifically to certain conditions that we see often in our pets. So today I also brought back Elizabeth Newton, as you remember from last week. Hi, Elizabeth.
Hello, good to be back.
So Elizabeth is back on because she's going to be an extension into that herbalism that we really want to dive deep into. Elizabeth drove all the way up here. She was actually at the spa probably bathing some dogs today. So she's up here today and we're going to do this and talk a lot more. We're going to be talking about pancreatitis, we're going to be talking about inflammation, and hopefully have some time to get into some anxiety and some other conditions that are, in my opinion, an epidemic that our pets are facing. So without further ado though, I am so proud to have through Skype in our studio today, I would like everybody to welcome Dr. Chris Bessent. Thank you so much for being here.
Yeah, absolutely. Thank you so much for having me.
How are you?
Great. It's a beautiful fall day in Wisconsin, so it's fabulous.
That's awesome. So, Dr. Bessent, can you just tell our listeners a little bit about your background and how long you've been a veterinarian and some of the amazing degrees that you have?
Yeah, my story is kind of interesting. I'm a veterinarian and have been a veterinarian for 30 years.
Wow.
And I didn't really get into herbalism. It really, for me, it came as a quest to be able to help every patient that came my way. And herbs are somewhere in that extension before you get to pharmaceuticals, where pharmaceuticals are one drug put into a pill at X amount of milligrams, and it's usually a single drug, versus herbs are made up of hundreds, sometimes thousands of different active ingredients that all work in synergy together, that the whole is greater than the sum of the parts.
Right.
And with that,
Wow.
You have some things in herbs that help to dampen any of the negative side effects. So what I found as a practicing veterinarian is I wouldn't throw away pharmaceuticals at all. Pharmaceuticals are fabulous when we need them.
Yeah.
But when you have other tools in your toolbox, like I have herbs and acupuncture and chiropractic and talking nutrition, I can use all of those less toxic tools first.
Yeah.
And try to use those more actively in my practice. But when you need an antibiotic, thank God that we have them.
Yeah.
So it's not throwing the baby out with the bathwater, it's using all of it.
Yeah. And I think that's important, because I think people want to put us in these groups, right? Like, you're an herbalist, so you would never take an antibiotic. Or for me, because I'm not a fan of the Bordetella vaccine, that means I'm an anti-vaxxer. Like, I don't get to be, holistic and understand what that whole word means, and instead we get grouped. So I think it's super important that your veterinarian has all these tools in their toolbox. And when you decide you want to go to a veterinarian, I think it's super important that we ask what their toolbox is. What do you have in your toolbox? Do you have, chiropractic, ozone therapy, like all of these different things? Because without them, you're limited. Boom, I just go to the antibiotic.
I was none of the voodoo bed. But what happened in my area is that all these naysayers saw that patients that came to me got better. And so what they said is we don't know what she does and we don't understand Chinese medicine, but what we see is that these patients get better and they feel better. So I literally had the oncology department of UW-Madison sending cancer patients to me because cancer patients that got acupuncture and got herbs and we discussed food healed so much better, and they lived a longer, higher quality of life than patients that didn't get that. So I think we're very fortunate in this day and age that if your veterinarian is resistant to it, they're behind the times, because most veterinarians are perfectly happy to work together.